Stockport and Tameside NHS Foundation Trusts are committed to improving the quality of care we provide to our patients. It is well known that clinical research provides the evidence base to answer key questions that help us tackle health and care issues in our population. Embedding and maintaining an active research ethos in our trust is vital to fostering a better future for our patients. We deliver a wide range of research projects across many specialties to support this vision. We are also often asked, what is the impact of research? This story will answer that very question from first-hand experience. We will share with you a very special patient's research journey and the positive impact the research study had on his severe chronic rhinosinusitis condition and overall hospital experience.
In recent years, much has been done to find a treatment in achieving clinical control both of the upper and the lower airways in patients with coexisting chronic rhinosinusitis and asthma, as these patients are more difficult to treat. Chronic rhinosinusitis is a heterogeneous disease divided into two phenotypes, with and without nasal polyps. Patients with severe chronic rhinosinusitis with nasal polyps and asthma are at increased risk of decreased quality of life, fixed airway obstruction, repetitive surgery and hospitalization.
It's quite debilitating. I mean, it's obvious that I wear glasses and I wear hearing aids, but it's not obvious that you can't smell very much and you can't taste very much. Also, your sleep is affected because you sleep with your mouth open, you can't breathe through your nose. I couldn't breathe through my nose at all. So at that point, you breathe with your mouth open all the time, and you wake up in the night and your mouth's like a piece of carpet, really. Most of the times I think people thought it was hay fever or some allergy or whatever, and it wasn't until one of the doctors actually looked up my nose and said, oh, I think it's polyps, and then they referred me to the hospital. The treatment options before the research, well, I'd had sprays up the nose from the doctor for a number of years, but they didn't work.
This condition can be treated with appropriate medical treatment like nasal corticosteroids, saline rinsing, and occasionally course of oral corticosteroids. Patients who still experience low quality of life despite optimal medical treatment might need sinus surgery. However, surgical treatment has a reported recurrence rate highly varying from 40 to 79%.
They offered me the chance to go on the trial. And because I suffer with white coat syndrome quite badly, I didn't want the operation on the nose. So I decided that I'd go, I didn't want the injections either, quite frankly, but it was the lesser of two evils, and I decided to go on the trial. For two reasons: to help with the white coat syndrome and to hopefully get some benefit from the trial. When I first came, I had my blood pressure checked, as you do, and it was something like over 200, well over 100 on the two numbers. And it's a physical reaction, not just something in your mind. So as part of the investigation, you obviously have a camera shoved up your nose, and Mr. Ruddick showed me the results on the screen immediately afterwards, and you see inside your nose, which you could see the improvement straight away. End of the treatment, when I was having the blood pressure taken, then it was virtually normal, because I was coming to the same place, same nurse, same people, same doctor, so you get used to that, and it has helped. So that part of the treatment, it wasn't the treatment, but that part of it did help a lot. Yeah, it's had a big impact. Yeah, I'm less frightened of hospitals. Still not keen. I certainly couldn't have had the. I couldn't contemplate having the operation on the nose to do it that way. So the treatment by injection was the way to go for me.
Multiple clinical studies similar to this one have shown that immunotherapy, or biologics as we call them, are efficient for treating either lower and upper airway inflammatory disorders. Biologics can improve symptoms of nasal congestion or obstruction, nasal secretion, and loss of sense of smell and taste in patients with chronic rhinosinusitis with nasal polyposis. They can also improve a patient's health-related quality of life and reduce the need for systemic corticosteroids and nasal polyp surgery. Unfortunately, immunotherapy for chronic rhinosinusitis with nasal polyposis is currently only available to UK patients participating in clinical trials. Having this study in our department has made this treatment available to our patients. Positive results will hopefully help bring this type of treatment available to a wider population. On the background of conducting this clinical trial in line with all ethics and safety protocols, research department has been able to attract clinical studies to other departments. And there is also a significant financial benefit for our department as well. After successfully recruiting patients, funds that we have received have helped us acquire additional state-of-the-art ENT equipment, which will benefit all our other patients as well.